we have the mission to be the expat friendly hospital. We also got the JCI accredited to guarantee our quality of the treatment.
I have to tell you, when I walked in the door, I felt like I was at a 5-star hotel and not a hospital.
The prescription, the bill, everything, and talk to your international insurance company. So no need to do anything, you just come to the hospital, that's all.
As a cardiologist, what are the 1 or 2 things you would recommend doing to keep their heart healthy as they get older?
I think you know that you look healthy.
Thank you. Now, I know many of you think about Thailand and have heard that it's a medical tourist destination, and you've also probably heard that the cost of medical care here in Thailand is a fraction of what it would otherwise cost in the United States. Today, I'm honored to be at Phyathai Hospital number 2, so you can see firsthand exactly what you might get for your money here in Thailand if you choose to have medical procedures here. You're going to get to see the quality of the facilities and meet a couple of the doctors here or directors of medicine at the heart clinic where we are currently, and you're going to meet an orthopedic surgeon whose department does 50,000 orthopedic surgeries a year. So let's go ahead and dive in and see what a Thailand private hospital is all about. So I'm pleased today to be joined by Kun Sorawang, who leads the communications here at Phyathai Hospital. Thanks for having us today.
Thank you very much for coming.
It's our pleasure. I have to tell you, when I walked in the door, I felt like I was at a 5-star hotel and not a hospital. It's just beautiful here. How long has this hospital facility been here?
Right now, it's just like about almost 40 years already for this hospital.
Okay.
It used to be a single hospital before, but right now we also have a group of hospitals.
How many hospitals are called Phyathai, and then how big is the other affiliates?
Right now we have 6 hospitals named after Phyathai, but we also in the group of the BDMS.
Okay, yeah. That's quite a bit. And mostly located here in Bangkok?
It's all over the countries, over here and also in Chonburi as well.
Okay, very nice. And I noticed, and thank you for this, that you guys just opened up a clinic at the All Seasons place right across the street from our office building, making it convenient. Are you planning to open up more clinics here in town?
Definitely. There will be more clinics to get very easily access to the people.
Excellent. So this is for folks who are overseas, who are considering coming to Thailand to make Thailand their new home as an expat, or for medical tourism, because they've heard that the cost of medical care here is quite a bit better than it is in most Western countries. So let's say I'm in the US in Los Angeles, where I came from. How would I begin my journey with Phyathai? How would I first reach out to you, understanding that maybe I'm a little concerned about the language barrier and maybe different kinds of practices that you have here?
So first of all, I have to tell that our hospital, we have the mission to be the expat friendly hospital. In terms of the demographic, it's just 2 steps away from the BTS SkyTrain. So it's really convenient for the expat to come. And also we set up not just only the staff, but we also set up the ecosystem of the hospital to become the expat friendly hospital. We have a partner just like the international insurance and also international partners. So this means that we can serve all of you with the same quality of the Thai people. We also got the JCI accredited to guarantee our quality of the treatment.
Excellent. So if I'm going to contact you, I noticed as I came in the door here, there was something called the International Relations Center. Can you tell us how that works?
For the International Relations Centers, we set up these departments because right now we have a higher and higher number of the expat right, living in Thailand. So these department will taking care not just only the language, but also they taking care all the step from the beginning, just like the first step that you enter the hospital. So they will have a staff, right, accompany to you, guide you, right, what to do next step, navigate you to the doctor, and also for the communication as well. So everything will be done just like you have the good partner.
Sounds like what we would call in the United States a concierge service. And you talk about language. So in addition to English, how many languages do you offer your foreigners?
Actually, right now we have 6 to 7 languages.
6 to 7.
But the main languages is definitely English, Chinese, Bangladeshi, I mean, and also Arabic. Yeah.
So when we talk about concierge service, you said, coming into the hospital, you'll have people here at the International Relations Center to guide their journey. But you guys start the concierge service before people even get here.
Right.
I mean, I think, do you offer transportation from the airport as well?
Yeah, definitely. Because like the first step is not just the first step to the hospital, but the first step when they come to Thailand, we provide to them the transportation services, just like that, pick up them to over here and also to our partner hotel around here as well.
And how about if somebody wants to make an appointment? Let's say they have a particular need, it's heart related, maybe it was back related. How do they think about how they book that consultation or that appointment with their doctor?
They have both online and offline patients, but I believe that most of you is like they would like to do it online and book it in advance. So we also have the website, and also we have the separate team. We call it single gateway team. So this team will consider and look after your inquiry, and then consult with another team. We call it medical coordination team. So this team also have the foreign doctors as well. Everything will be just like on one paper. So you will get exactly the transparent price and also what the condition and what doctor that you have to see.
So you said transparent price.
Right.
And, for folks in the UK or Australia or Canada, they have a public healthcare system and really don't pay anything. But in the US, transparency and pricing is a big issue because it's difficult to know exactly how much something is going to cost. How do you make pricing transparent to your clients here?
Exactly, sometimes it's really difficult to identify the exact price, but because we have many experience dealing with so many cases of the patients already, so we can estimate the cost, right? What would it be? And also we have the common procedures. So we list the pricings of the procedures, and also we have the price estimation team. This will be the process that can get it done within 24 to 48 hours.
That'll give people a lot of comfort. And let's talk for a moment about families, because if someone's coming here for a big procedure, let's say it's a surgery,
right?
How do you handle families? What is their experience here at Phyathai as they're waiting for their loved one to heal and come out of the hospital?
We also provide a big room that's for the family. So we have the side bed, 2 side beds in the one room, so they can live together in the one room. Additionally, we also have the partner hotel around here. We have deal with them, and we have a special discount for the family who come together with the patient also.
So in the hospital room, it sounds more like a suite that the family can actually lie down in a comfortable bed. I've spent too many evenings with my parents or with loved ones sitting in an uncomfortable chair all night. That sounds like a pretty good deal. And if they're just here during the day, do you have food options? Do you have places that they can just hang out and wait for their loved one as they come out of surgery?
Right, yes. We also have the variety of food, Western food, Thai food, and also halal food as well. So any food that they want, so they have it here. But by the way, we are located just next to the Ali. Ali area is very good area for the food, and the shopping, everything is over there. And it's just 2 stations away from Chatuchak Market. Sunday market.
Yes, Chatuchak Market is a huge market,
Really
one of
huge.
the biggest in town. And that BTS, I will tell people that aren't really familiar with Bangkok, you can get stuck in traffic here. The SkyTrain takes you above the traffic and
Right.
is a wonderful amenity to have. The patient experience, I want to talk a little bit about that. Can you give our viewers a sense of how Thai culture plays into the care here? Because my experience has been when I go to a hotel or other service provider here in Thailand, there's just this genuine sense of warmth and hospitality. Talk a little bit about that, if you will.
Okay, so further than our quality of the treatment, they also have these services. We call it the Thai style services. So we come with the smile, with the warmth, with the empathy. So this is the main reason that make the Thailand become the top medical destination of the world, because like these kind of the cultures it cannot be seen anywhere.
Well, Thailand is known as the land of smiles. And I
Yeah.
think you can tell when someone is genuinely caring and when they're just sort of dealing with you as a number or just another patient. And I will tell people that if you come to Thailand, whether it's at Phyathai Hospital or your hotel, you're just going to get that sense of warmth. I call it a hug that you get here in Thailand. So I'm going to visit with a couple of your medical professionals in the heart department, orthoscopic surgery department.
Okay.
And then we can come back and chat a little bit about how people kind of go through the payment process, which is not nearly as painful as surgery, and you guys make it pretty easy to deal with. So we'll talk about that in just a moment. So I'm here this afternoon with Dr. Tuan, who is the director of the Heart Center here at Phyathai Hospital. Dr. Tuan, thanks for joining me.
Good afternoon.
Good afternoon. So heart health is one of the specialties offered here at Phyathai.
Yeah.
About how many doctors do you have in your department right now?
Actually, we have the full time for about 8 people.
8 doctors.
Yes. And we have also the active consulting doctor who come in regularly. Should be about nearly 10 person to coming in our hospital regularly.
Okay. And if I'm sitting in the United States and I'm thinking about becoming an expat here in Thailand, relocating here to Thailand, what kind of heart services could I expect to find in your department here?
Yeah. We include from the beginner for the people who like to know exactly what is the risk of cardiovascular condition. So sometimes we call cardiovascular screening. And the second thing, as the serious situation such as the cardiac care unit, cardiac catheterization, and also pacemaker implantation. We also include our cardiovascular thoracic surgery in our team. We also put the ECMO, which is the advanced technology to recover person who is badly injured for cardiac condition. One last thing, we include mobile CCU in our system.
Very nice. And I know you've spent some time in the United States, University of Alabama, Michigan, and Harvard University, quite good schools. What would you say to someone from a Western country who is used to the hospital system there? Any differences between what you experienced in the United States and what they may experience if they come to Phyathai?
Yeah. For the people who coming abroad, let's say staying in Thailand for a long time, they need to know detail of medical records is very essential. So we need to have the medical records from your home country and coming in and have the current assessment with our advanced diagnostic technology in our hospitals.
Let's talk about medical technology for just a moment. I've been around for a few decades now, and I've learned that medical treatment changes over time as the science gets better. How does Phyathai and how do you as a leader of your department keep up with the latest technology, training, and so forth?
I think at the moment, we need to be sure that our hospital, we follow the international guidelines. And we also use the advanced technology to make sure that our accurate diagnosis and the pathway that we need to put and ask the patient and the family to follow should be evidence-based approach. In addition, our hospital also is accredited by the Joint Commission International. Our main focus is to try to put our procedure in the safe, consistent, and high quality of cardiac care. We can ensure you about that.
Excellent. So if I went into a surgical room here or a surgical room in any of the universities you studied in America, would I see any difference?
Quite the same, right?
Yes. Okay.
At this moment, Phyathai Hospital also in one umbrella of BDMS group of hospital. We also affiliate with Oregon Health Science University. To the future, we are pretty sure that we can catch up new technology, new knowledge, how to use them into the expat person in Thailand or maybe for Thai people also.
Excellent. And in terms of continuing medical education for your team, how do you approach that?
As far as I talked and I presented before, in one element or one chapter of the Joint Commission International, we need to have, we call the training syllabus for the doctor and the nurse. I myself as the cardiologist, I need to send all my log files to medical director that we need to have at least international CME 20 chapter for those.
20 chapters?
Yes.
I thought CLE was tough, but CME is even tougher.
Yep. And we just try to make sure that we understand what changed, what still continue to do the same way as before. And we need to, if we have adopt new technology or new knowledge in cardiac care system, everyone who use that technology need to be trained before use that technology. We need to be sure that we provide the same way as technology demand us to do that.
And let's say you do have an expat living here and they may live in another province. My wife and I come from Phetchabun. We're simply country folk. Wow. Do you have any way to stay in touch with your clients through telemedicine?
Yeah. After pandemic of the COVID-19, we adopt the video conference, taking care of it. Sometimes we call telemedicine. We have it in our heart center. We have in the outpatient unit. We also use that kind of technology up to now. As I talk to you, we have mobile CCU. We can send our mobile CCU, investigate, take a look at you at site. If we have no need to bring you back to our hospital at that time, we just instruct you how to stay furthermore safely and how to manage the medication by our pharmacy team.
Wow. So I know you run a busy department and you have many patients. I just have one last question, a bit of free medical advice for our viewers. As a cardiologist, what are the one or two things people you would recommend doing to keep their heart healthy as they get older?
I think you know that you look healthy.
Thank you.
The first thing is that our mental health should be good, like I said, our mindset. And the second thing, you need to know yourself that in the past or maybe current medication that you need to treat, that high blood pressure, diabetes, or any antithrombotic agent, you need to take it regularly. And one last thing is that what is mandated by your chronic medical condition like diabetes, like a coronary artery disease, you need to have exercise, how many minutes you need to walk. Exercise is medicine, especially for the people to prevent themselves from cardiovascular disease.
Now, I just want to go on the record. I did not prompt the doctor ahead of time to mention exercise, but I'm a big believer in moving vigorously every day. And thank you for that. I think that's excellent advice for our viewership. Okay. Doctor, thank you very, very much for your time.
Okay, thank you so much. I'm really happy to talk with you and discuss some good information from our hospital. Thank you.
Thank you very much.
สวัสดีครับ
I Hello, doctor. Thank you for
Yeah.
joining me today. You're the director of orthopedics here at Phyathai?
Yeah, I just take care the whole of the orthopedic cluster here.
Great. And your specialty, hip and knee, as I understand it.
Correct.
Okay. How many doctors do you have in your department?
In our department, we have around 63 or 64 orthopedic surgeons.
Wow. 63 or 64 surgeons. That's a
Yeah,
lot of
we
doctors.
quite have the number of the surgeons here, even compared to the university.
That's amazing. Now, I know you've studied all over the world, Switzerland, Italy, Japan, also Syracuse University? Near and
I
dear
just
to
come
my-
to see something
Okay.
interesting of the case at when I'm very young at the time.
So I understand over the years, technique and science has led to different sorts of techniques, different sorts of medical devices, and so on. So how do you keep your department and the 63, 64 doctors current on all the newest developments in your area of practice?
We just balance service, surgery, and academy. We cannot have the surgeon get along with the new technology all the time. But because of we shoot the visiting surgeon to our department, they come with not the service, they come with the technology and knowledge
Yes.
and the quality of the practice.
And if one of your patients returns to their home country or is an expat, maybe living in a different province, how do you stay in touch with them? Do you also use telemedicine in your practice as well to stay in touch with your patients?
Now we have two things. The first thing we use telemed. We have 2 weeks. We have to talk. We have to see the wound. 1 month. We have to see the exercise.
You have to be on hands-on.
Yeah.
Yeah.
And then now we're gonna develop the application that's very convenient for the patient to the contact us.
Hands-on and technology together.
Yes, something like that.
Yes. I have a question for you for our expat community here. I went to university in Northern California and most orthopedic outcomes were due to skiing. I know there is no skiing in Thailand.
Yes.
So as a doctor, what do you see is the biggest cause of people having orthopedic problems other than just aging in Thailand?
It's different. For me,
Yeah.
the patient average is 70 something. For example, for the sport medicine here,
Yes.
that take care for the sport, young man, love sport something,
Basketball, football.
whatever.
Yeah.
We have increased the number of that.
Yeah.
Our two staff from the sport medicine, they also work for our national team.
Yes.
They've been experienced with the doctor of our Thai national team ready.
Yes.
They come to see that kind of the sportman,
Yeah.
soccer or whatever, and they know the pattern. You need the training, you need nutrition,
Yes.
because our sport medicine is quite experienced
Yes.
with the athlete of the country already.
Yeah. My basketball days are well behind. So, doctor, my last question is, what can people do to prevent deterioration or injury so they don't have to end up on your table in the first place?
Yes, first they have to prevent trauma because the lifestyle is changed, but they have to be good, be careful about the trauma, whatever accident. And the other thing is the genetic. If the parent or the whatever in his family have the osteoarthritis and do the replacement, and if they concern it, we just have to study the biomarker of the cartilage. We can detect the cartilage degradation. So if they concern, they can come here and we have biomarker to detect. If the biomarker is normal, it's fine. You can enjoy your life. But then they have something, the biomarker is changed. You have to be careful a little bit. You have to have a control and you have to good exercise. Something have to be concerned. We have quite have the early detection for that disease.
That's amazing. And I'm a big believer in exercise, Len Yoga. keep yourself fit and healthy.
I know. Yeah, look at you. Very smart, huh? You take care. You are very
Just a good habit. Doctor, I know you have a patient now. Thank you very much for your time.
Yeah.
ขอบคุณ
Thank you.
มากครับ
ขอบคุณมาก See you.
See you. Pleasure talking with your doctors. And now we've got to get into the maybe least pleasurable part of the conversation. But I found here in Thailand that private insurance is great. The payment process here, why don't you describe that a little bit to people who are either paying out of pocket or they're making an insurance claim?
Oh, actually, we provide the flexible options for the payment, including with the cash, credit card, or direct billing for the international insurance. So we cover it all.
Okay. And if somebody had international insurance, do you have a claims desk? How does that work? Let's say they're coming out of the hospital. You know, in America, we get a bill 6 weeks, 2 months later, frequently a surprise. Thank you for talking about the clarity of your estimates. But, you know, how does that work as people are coming out of the hospital?
You just come to the hospital because we have an international insurance team who taking care of all the documentation for you. So they will be the one who taking care of the prescription, the bill, everything, and talk to your international insurance company. So no need to do anything. You just come to the hospital. That's all.
And for expats like me, I have a domestic insurance policy through a Thai insurance company.
Right.
I assume you also take Thai insurance as well.
Right.
And to give our viewers a sense of expense, what could people expect to pay in terms of a percentage maybe less than they're paying in the United States?
Let's say it is about 50 to 60% cheaper compared to the USA. Over here, we also provide the same quality of the treatment. We also have American board doctors, and also we have a JCI accredited. So no worry about the treatment. We provide the top with the affordable price.
Well, a 50 to 60% discount is quite a discount. And I'm sure it's probably more than that depending on some of the procedures, right?
Right. It depends on the procedures.
Yeah. And then in terms of prescription drugs, let's say I'm coming over from any Western country, how available would my prescription be? And do you need my prescription from overseas, or can you provide my prescriptions that I need?
I can provide to you the prescription in English or any language. We have the team of this to taking care of all documentation.
Excellent. Excellent. I do find that you can go into almost any pharmacy and without a prescription, and you can get most of what you need at about a fraction of the cost.
Right.
So people don't have to worry about making sure that they're bringing over all their medications from their home country.
Yeah, right.
The last thing I want to talk about is communications, and I mentioned this briefly with the doctor, but I wanted to talk with you. You say you have many hospitals in the hospital group. Is there communications between those hospitals, or each hospital kind of is its own ecosystem?
Actually, it is the collaboration. We call it a collaboration of expertise. So sometimes we also consult each hospital as well. But for Phyathai Hospital over here, we also have all of the department, and we working as the team. For one case, it's not just only one doctor, but we have the team of the doctor, right, come to help together at one case. So this is the collaboration of the expertise.
And everybody's talking. That's
Right.
excellent. So in addition to medical treatments, for a lot of us of retirement age, wellness and prevention is really important. And is that something that Phyathai also offers?
Yeah, we also have a Phyathai Premier Life Center. It is focusing on the anti-aging and also the wellness.
Well, if people wanted to begin their journey with Phyathai and just start to get to know you guys a little bit and reach out to you, what's the best way for folks to do that?
Let's just scan the QR code. We will link it to the single gateway department, which can be the beginning of the passage to Phyathai.
So when people click on that link that we've offered in the description, what will they see?
So they will link directly to the inquiry session. So if you have any inquiry, medical report, so you can submit it to that link.
Got
so
it.
our team will get it done.
And if somebody wanted to talk to someone here at Phyathai,
Right.
do you offer that sort of counseling as well?
Oh yes, we will provide to you the number, the contact number for the international patients, and also if you need more information, so just click the link of the Phyathai website.
So you have a phone number, is that WhatsApp
Right.
and line as well?
Yes.
All right.
WhatsApp.
Okay.
Including WhatsApp as well.
And what is your website address? www.
.phyathai.com.
Got it.
Right.
Well, thank you very much, Kun Sorawang. It was delightful to speak with you. Thank you for your hospitality here. And what I'd say to anyone coming to Phyathai too is you'll feel like you're in a resort hotel, not a hospital, and it's filled with warm and lovely people. And so begin your journey anytime. I'm sure Kun Sorawang's team and his colleagues here would be delighted to talk with you. Hey, so thanks for spending a little bit of time with us here at Phyathai Hospital number 2, located right here in the heart of Bangkok. I hope you get a sense of the quality of the medical care, the quality of the facilities, the lovely doctors, the attention to detail. But mostly what I'd like to relate to you is the compassion of all the people I met here today. The staff has just been lovely. Thailand is the land of smiles. So you can come to Thailand as a medical tourist, or feel comfortable retiring here as an expat and know that you're going to get excellent health care at an affordable price with people that really do care about you and the outcome. So thanks. Take care.